Hi, my name is Raymond Severa. I'm a respiratory care student at Miami-Dade College. Today I'm going to be demonstrating how to properly perform trach care and or stoma care with a patient with a tracheostomy that happens to be on room air. So I'm going to go ahead and look at the patient's chart. I'm going to identify the patient. I'm going to look at his wristband, make sure I have the same medical record number, date of birth, first and last name, and there is an order for trach care. As I said, the patient is on room air, so oxygen adjuncts administration is not necessary. Alright, so now that I know I got the right patient, I'm going to go ahead and explain to him the procedure. Sir, I'm going to be performing trach care on you. I'm going to be removing your inner cannula and cleaning around your tracheostomy site. It's important because it does prevent infection. Alright, patient understands and consents to the actual procedure. So I'm going to go ahead and get set up. I'm going to go ahead and use proper hand hygiene. Putting on hand sanitizer, making sure I cover every bit of my hands, and I'm going to let it air dry. Now that I do have my gloves on, I want to make sure all my equipment is here and set up properly. I got a BVM with an end tidal seal too, and it's just out of the package, so it's still good. I'm going to go ahead and crank the oxygen source up and make sure the reservoir bag's filled. Check the suction. There's a Yanka already on here. And make sure that the pressure does not exceed a negative 120 millimeters of mercury. Alright, now that I got everything set up right, on this side, I'm going to make sure that my trach kit. And I got this is an extra set to make sure that I have, after I'm done cleaning the patient, it'll just hold the trach in place. I'm going to take one drape out, and I'm just going to use it and put it over the patient. Just keeps things a lot cleaner. Now this right here is going to be my sterile field. I want to grab it from a corner, and I want to stay less than 2 centimeters from the edge at all times, making sure that it remains sterile. And I'm just going to let it fold open. Just grab the corner of the other edge. There we go. Go ahead and take everything inside my trach care kit, tray, and just slightly put everything in there. I'm going to take out my normal saline and my hydrogen peroxide, and I'm going to go ahead and put sterile water in the 2 smaller trays, and in the larger tray I'm going to put the packet of hydrogen peroxide in there, and then put normal saline in there, so that make sure it's going to be 1-to-1 ratio. And basically I'm going to use that one side with the hydrogen peroxide and normal saline for the actual cleaning, and the other 2 sides are going to be just for rinsing. Alright, now that I know that I have everything set up, I'm going to go ahead and take out my sterile gloves. Move this out of the way for the time being. Alright, now that I got my sterile gloves set up and ready to go, this is a good time to assess the patient to make sure all his vitals are stable. I'm going to go ahead and grab my my stethoscope. And I'm going to check the patient's pulse. I'm going to note his rate, rhythm, and quality. And I'm going to check his lung sounds. And listen, check his respiratory rate and also note the rhythm and quality. Once you went ahead and assisted the patient, I noted down all vitals. Patient is stable, and his lung sounds are clear in all fields. So I'm going to go ahead and ready to don my sterile gloves. Alright, now that I have my sterile gloves on, remove the pre-cut 4x4 that's in place, discard it, take the inner cannula, twist it, unlock it, counterclockwise motion, remove it, go ahead and I'm going to put it inside the hydrogen peroxide and normal saline 1-to-1 mixture and let it sit for a second. As I'm doing that, this is my sterile field. I'm going to take Q-tip applicator and I'm going to use some hydrogen peroxide and I'm going to clean around the actual trach site, clean all the secretions, start from the inside, working my way out. And this time, do the same thing. Valve. And then discard it in there. And then I'm going to take one final one and use normal saline. Make sure everything's clean off all the hydrogen peroxide. Now I'm going to take tracheostomy, inner cannula, grabbing my pipe cleaner, and basically dunk it in, making sure that all secretions are actually removed. And if the patient wants a mechanical vent, obviously I would, once I remove the inner cannula, I'm going to replace it with another inner cannula and put them back in the vent while I'm actually cleaning this. If it's disposable, I would just swap it out, obviously. Now I'm going to go ahead and just put this in some sterile water, making sure I got all the hydrogen peroxide off. Set it there for a second in actual normal saline. Take a 4x4 and there's anything left on the plate of the actual outer cannula, I'm just going to go ahead and just clean it off. Just use sterile water to wipe off the peroxide now. Alright, now that that's set up, take this out. Got my inner cannula. I'm just going to insert like 9 o'clock. And I'm going to turn it clockwise to lock it. Alright, it's locked and it's in place. I'm going to take my dressing. That's pre-cut. And just slide it in place. You never want the actual tie holding the tracheostomy to be too tight. You want to make sure there's at least enough room for 2 fingers comfortably. And once you got it set up, nice, I'm going to go ahead and change the actual strap. And there's different ways to do this. What I like doing is just going to disconnect this one end, hold the actual cannula in place so it's not going anywhere. Tracheostomy screw is now secured. Let me discard this. And I'm going to go ahead, reassess vitals. I'm going to check his respiratory rate and his lung sounds, rhythm quality. I'm also going to check his pulse, rhythm quality. And once it's fine, I'm going to make sure I get rid of all my material, disposing of it properly. Anything that's contaminated will go into a red biohazardous bag. And I'm going to make sure my patient's in a comfortable position and make sure that both rails are up on the bed before I leave the room. And I'm also going to get rid of my PPE at this time. And as soon as I get rid of my PPE and step outside the room, that's why I'm going to make sure I chart all the information, date and time of when actually perform the trach care. Any complications that I might have stumbled upon, but there wasn't any. So basically, it's just date and time and the actual intervention performed. I'm going to go ahead and wash my hands before I leave the room, now that I got all my PPE off. And then I'm going to go ahead and chart everything that I did once I leave the room. Thank you for watching this video.